This is the Medication Administration Skills Evaluation. Your objective is to prepare, administer, and document medication via the oral and parenteral routes. Any questions before we begin this exam?
No.
Begin when you are ready.
Okay. I'll start with the procedures for the oral administration of medication. First, I need to verify the provider's orders. Next, I need to ensure the 6 patient rights, which are right medication, the right dose, the right time, the right route, the right patient, and the right documentation. The equipment needed for this procedure include an SF600, medication order, a pill counter, pill knife, medication, non-sterile gloves, and fluid for consumption. Hello, sir. I'm HM3 from Mono, and I'll be assisting you today. Can you please confirm your full name and date of birth for me?
My full name is Vincent Ramos, and my date of birth is June 17th, 1980.
Thank you. Do you have any drug allergies?
No.
Your provider has ordered that you receive 1,000 milligrams of acetaminophen orally. Do you have any questions before we begin?
No question.
Now, I'm going to calculate the dosage and check the expiration date. Next, I'm going to perform hand hygiene and don non-sterile gloves. I'm now going to count the dose and administer it to the patient.
Your patient has taken the medication.
Now I'll document the time that the medication was administered, and that will complete the medication administration oral skill. I'll move on to the parenteral administration of medication for subcutaneous injection. Once again, I'm going to verify the medication order and ensure the 6 patient rights. The equipment necessary to complete this procedure include an SF600 or local form, non-sterile gloves, a syringe with needle, antiseptic swabs, the medication to be administered, 2x2 gauze, and a sharps container. Can you please confirm your full name and date of birth? Do you have any drug allergies?
No.
Today you will be receiving medication via the subcutaneous route. Do you have any questions before we begin?
No.
Now, I'm going to calculate the dosage and check the expiration date. Then, I'll prepare my syringe. First, I'm going to wipe the stopper with alcohol. Next, I'll pull the plunger of the syringe back to the exact mark on the barrel of the syringe for the prescribed amount of medication. I'm going to remove the cover from the needle aseptically and insert it into the vial at a slight angle with lateral pressure. While I do this, the vial should remain flat on the work surface. The needle tip needs to remain above the solution line while I push the plunger into the barrel to inject the air. I'm picking up the vial and inverting it at eye level. I'm pulling the needle back so its tip is below the solution level. I'll pull the plunger down until slightly more than the required amount of medication is in the syringe. Holding the syringe at eye level, I'm going to tap any air bubbles to the top near the needle and expel excess air and fluid, leaving the exact amount of the dose in the syringe. Placing the vial back down on the surface, I can now remove the needle from the vial of medication. I'll recap the needle using the one-hand scoop method, then label the syringe with the patient's name, identification number, and the name of the medication, dose, vehicle, and route. When I'm finished, I'll prepare to administer the medication by performing hand hygiene and donning clean gloves. First, I'm going to select a site for injection and expose the area for good visibility. Next, I'm going to cleanse the area using an antiseptic swab, making sure to move out in a circular motion 2 inches in diameter. Using my non-dominant hand, I'm going to hold the gauze between my third and fourth finger. I'll pick up the syringe with my dominant hand and aseptically remove the cover from the needle. Turning back to the patient, I'm going to support the skin at the site of injection by gently bunching up the tissue between my thumb and index finger. I'm going to hold the barrel of the syringe using my thumb and index finger and bracing it with my 3 other fingers. I'll insert the needle bevel up into the skin at a 45-degree angle with a firm, quick forward thrust. I'll release the pinched up skin and aspirate to see if there is any blood return. If not, I'll inject the medication by pushing the plunger into the barrel with a slow, continuous motion. Once complete, I'll remove the needle, drawing it out with a straight, quick motion. I'll apply pressure to the site with gauze and dispose of the needle and syringe in a sharps container. I'm going to take a look at the site to check for any complications and apply adhesive bandage if needed. Finally, I'll doff my gloves and perform hand hygiene. After 15 minutes, I'll check the patient for any adverse effects and document the procedure in their record. Moving on to the parenteral medication administration for intramuscular injection, I'll follow the same preparations I did for the subcutaneous injection. Next, I'm going to select a site for the injection and expose the area for good visibility. I'm going to cleanse the area with an alcohol pad, making sure to work outward 2 inches. Using my non-dominant hand, I'm going to hold the gauze between my third and fourth fingers. I'm then going to aseptically remove the needle cover from the needle. I'm going to spread the patient's skin at the site of injection with my non-dominant hand. Grasping the barrel of the syringe firmly between my thumb and index finger like a dart, I'll then plunge the needle, bevel up firmly into the muscle at a 90-degree angle. I'll aspirate to see if there is any blood return. If no blood is found, I'm going to inject the medication. Once the medication is injected, I'll remove the needle in a straight, quick motion. I'll immediately apply pressure to the site, making sure not to massage. I'll then place my needle and syringe in the sharps container. If the site is bleeding, I'll apply a sterile bandage. I'll then doff my gloves and perform hand hygiene. After 15 minutes, I'll check the patient for any adverse effects and document the procedure in their record.
Congratulations. That concludes the medication administration evaluation.